name is Amanda Hoff, and I am a nurse care coordinator with BrightStar Care. Today, I'm going to talk to you about hospice and what that might mean for you. A lot of times, hospice can seem like a dirty word in healthcare because people associate that with giving up, and unfortunately, that's really not the idea of hospice. The idea of hospice is that you're just changing priorities. So instead of focusing on curative measures, trying to fix whatever it is that is wrong with you, you're focusing instead on the quality of life and the time that you have left to spend with your family. So some important things to know about hospice is that it is covered by Medicare, Medicaid, and most private insurance carriers. It can be done in the home. Most people say that they do want to pass away in their homes, and that is how they can do that, via hospice care. Hospice can also be done in assisted living facilities as well as nursing homes. A hospice team is something that you'll hear a lot about. The hospice team will include a medical director who oversees all of the hospice teams, and on your team you will have a nurse case manager, you'll have a CNA, a social worker, and there are a couple of other people as well, but those are the main three. Your nurse will be responsible for helping to manage the symptoms associated with your illness, so any pain, any nausea, any wounds that you might have, or any medical equipment that you need, like catheters, IVs, and that kind of thing. She will also manage the medication, so if you are in pain and you need an increase, she would be the one, or he would be the one to do that. Your nurse will also be able to coach you on how best to care for your loved one. So a lot of times in hospice care, it is the families that are administering the medication while the patient is at home, so they would need to be trained on how to do that and how to use any other equipment in the home as well, and that is the job of your nurse case manager. Your CNA will be scheduled to come in and assist with a bed bath 1 to 2 times a week, and usually you can work that out with her on the hours that she's available. She usually will have a window of time that she can say. She's kind of like the Comcast guy in that respect, but most of the time they're able to accommodate your needs. Additionally, the social worker that you'll be working with will help you with all of the paperwork. They will help you with final planning as far as where you're going to call as soon as they pass away and that kind of thing. Your social worker will also help you get supplies and equipment, and all of it is covered under Medicare, and that includes large items like a Hoyer lift or a hospital bed. It also includes oxygen and any hygiene supplies that you might need as well. A few other people that you could have on your hospice team might include spiritual advisors such as a clergyman, or anyone else in your belief system, and also music therapists. Some of them offer that as well. You can use your personal doctor if you want to. At the very least, we can certainly keep them in the loop as to what's going on with the medications and what is happening with your loved one. If your loved one's symptoms are too intense for the family to be able to reasonably manage, then there are 2 ways that we can go about helping your loved one. Hospice will either provide a nurse to come in and sit with your loved one through the day and through the night to administer those medications and adjust them as necessary, or if necessary, we can bring them to an inpatient facility where they will have 24-hour nursing care. That can also be done for respite for the family. If you're going on vacation or something's happening elsewhere and you need to be there, we can of course send them to a facility where they will receive the care that they need. And hospice, it's generally the last move you make in your healthcare decisions, but if your illness goes into remission, you may be taken off of hospice care, in which case you could try to continue curative measures, or you would fall under the umbrella of palliative care, which covers hospice, but if you're not qualified for hospice, you can still get symptom management and work with the team that you had before, in a lot of cases, to manage any symptoms that you might be having from your chronic ongoing illness. Additionally, if you wanted to come off of hospice as your own decision at any time, you can make that choice. So if, for instance, new treatments become available, you can certainly come off of hospice on your own terms and continue to pursue those treatments. And that is it for information about hospice care, and thank you for listening.